Welcome back to the Movement Underground for another session sit-in video. I've got a really special guest slash client today that we're going to work with. This is my buddy Nick. Nick is a strength and conditioning coach, high school football coach, who we previously worked together a lot for his chronic low back stuff, and then things kind of turned for the worse where he actually had a disc injury. But really quickly, Nick, you want to give him the lowdown, and then we'll talk about where we're at now.
So 2016, just loaded up in RDL. Top down deadlift, way too heavy. That was like the first incidence of like, oh wow, I have a lot of low back pain. Dealt with that and like moved through it, and then went down the rabbit hole of let's fix my hip mobility, ankle mobility,
right,
glutes and stuff. Got back to normal. Probably like 2 years ago, 2022, had another disc injury on deadlift from the floor, from the mats, and came back to Mike, and we got back to a really good spot of pain-free movement and lifting. But obviously there were underlying issues. And then all it took last winter was a little too much shoveling. And I woke up and I was just in like what had to have been a 10 of 10. You always think you're at a 10 of 10 pain until you finally get there one day. So I finally got an image of it. The image showed a massive extrusion. And from there, got me healthy again. Before surgery, moving correctly, lifting properly and strong and pain-free. And now we're trying to work back from the pain of the surgery.
All right. What we have to talk about is anytime we get into a very particular movement domain, right? So in the strength and conditioning world, the big three, deadlift, squat, bench. Those are the big three lifts that everybody wants to see the big numbers for. That's what powerlifting meets are measuring and competing athletes against. But there's a whole lot more to strength and conditioning than the big three. Not to say that those aren't great lifts and exercises, but the more you narrow your focus to those three, you start to lose the movement variability and movement skills that are also important for just being a functional human being. So in addition to those things in your training, we're just going to start to work on unilateral stuff, multiplanar movement, getting out of the sagittal plane, moving side to side, rotating more efficiently so that he can go play golf and be effective and not have his low back screaming. The original diagnosis, or let's say, strategy being his hip mobility was, he had low back pain, he had really limited hip mobility. So right now what I'm doing is just our classic, like working those deep hip flexors to help open up some of this hip internal rotation. This internal rotation was extremely limited on Nick when we kind of reconnected a couple years ago. This had been what we were working on to be protective of his low back when he was in those deeper ranges of motion. So even from, like if we talk about like a linear motion of just hip flexion, which would require us to get down into that squat, that does have a rotational component to it. So in order to have really good linear mobility, we want to have good rotation at that hip, and that's what we're working on right now. So swing around, do this side. How did you feel after the exercises from last week? The pull-throughs, the hinges?
Great.
You've been doing those?
Yeah.
And no problem at all?
No.
Love that. Okay, so we're going to progress those even a little bit more today.
Everything feels good until I feel like I, don't have that control.
Okay. So what do you feel like you're doing that's not working for you?
Just creating too much tension. I'm so frustrated, the hip car is what I'm having an issue with. I'm so frustrated, so I just tense up more, trying to get more range of motion and have more control on it.
Right.
Realistically works the exact opposite. You end up over tensing,
Part of that strategy, remember, again, so as we kind of go through these correctives or these rehab movements, let's remember what the purpose of those hip cars were, right? The purpose of the hip cars were to just work on disassociation. I could care less how big that circle is right now. I care more about the ability for you to be able to use hip range of motion without necessarily having to go to the spine to get some, okay? So for example, like you could just cleanly internally rotate, you don't have to arch the back in order to create that faux internal rotation. So that's fine. I want you to do it with intensity. You know what I mean? You should be bringing intensity to the drills that we're doing, because these drills are really safe, man. You're not gonna hurt this thing doing hip cars, right? So, and that's the point. We're allowing that tissue to heal. You're still healing, but we're leveraging areas of your body in your rehab that don't have limitations right now. So that's totally fine. It's normal to be frustrated by stuff like that, especially when you're not good at those kinds of things.
I wasn't good beforehand.
Right, exactly. You're not
like
expecting
coming
it to
out
be a
of
miracle
surgery,
now.
you're like, yeah.
Right, but that's also why we put these things in place prior to surgery, right? So you have a little bit of experience with them While you're feeling pretty good, we get that surgical procedure, and now we're hitting the ground running. So this is advice for any of you out there who are maybe looking down the barrel of a surgical procedure, is link up with your therapist, your physical therapist, your athletic trainer, whoever you're working with, prior to the procedure. Put a plan in place beforehand. Don't wait. Don't wait until after to try to figure out your rehab, because the rehab's the more important piece. The surgery is 45 minutes and you'll be unconscious, right?
Yeah.
The rehab is the next 6 months, year of your life, and you're gonna be working with this person, so make sure you vet that provider, make sure they have experience working with, you know, the type of injury you have, and also that their approach is similar to or in line with what you wanna see, right? If you wanna see bare bones rehab, go to a big box insurance place. If you want something that's gonna get you back to barbell sports, it probably needs to look like it has some barbells in it.
Can I add a little? I mean,
Sure.
just even for the mental, I think
Absolutely.
where people let themselves go or let go and give up is like, I am frustrated. I want to be in a different spot, but I know that I'm with the right group of people. It's a whole team here, and they're going to get me back to normal.
You're gonna get you there, man.
quit-
We just get to be there.
Quitting or giving up or changing the appointment or figuring out how to skip the appointment, like it's not the answer. If I want all the things that I want of quality movement again and quality life, I got to put in the work to get there. So frustration's just a part of it, but
Right.
showing up is the bigger deal.
I love that, man. That's perfect. It's very well said. All right, kid, let's flip it over. And we're gonna lay your belly button on the bolster. And we're gonna put the feet up on here. Let me just lower that front side. Perfect. All right, so I like to put a bolster underneath the belly button. Again, especially in a situation like this, looks so much better, man.
It looks good.
Yeah, it looks great.
Surgeon was so pumped.
2 weeks out, this incision is nicely closed, but here's where we start to see how, you know, that skin doesn't want to slide or glide. It kind of puckers down, right? If I try to move that scar, it doesn't want to translate super free. You know, at this point in the process, you know, again, he's only 2.5 weeks out. Everybody's different. So your level of healing is going to be directly related to your level of health going into the procedure. So if you're really unhealthy, you might not heal as quickly. It might take 4 weeks for this incision site to look this good. But 2.5 weeks out, I'm gonna start actually manipulating this scar a little bit and just massaging the incision site just to get these layers to slide and glide so that he doesn't feel like he's got like a staple in his back where that's restricted because there's no gliding in between these layers of tissue. So we're gonna do a little bit of scar massage and work on his spinal erectors, and we're gonna start with some rehab exercises. Sliding that scar kind of back and forth. This is another reason I like to wear gloves. Again, you can see if I try to slide that scar, it puckers down. Again, that's just normal. You know, that's why we want to move this thing around, and then just getting him moving again will also help a ton. I like to use my elbow here. I'm just spreading that surface area out a little bit so I can use deeper pressure without it being so uncomfortable for him. You know, so again, the biggest piece of the next session today is that he and I had been working together on this for a year prior to surgery. Sometimes surgery is the right call, depending on the situation, but he already had a lot of his own knowledge, and we had already been putting this plan in place. So what you're gonna see now is kind of some of the routine that we've been putting in post-op to kind of help him expedite this process back to relatively normal training. We'll start with half kneeling hip flexor liftoffs.
Okay.
Then we're gonna go to some 90-90s. Let's work on that hip car together. Some peel-offs to the bridge. And then I wanna see if we can do some pull-throughs and some hip thrusts today.
Okay.
Okay? Like actual weighted hip thrusts. Okay. Let's start moving a little weight around, okay? Yep. Again, nothing crazy. We're gonna keep it hip thrust so that we're not creating any shear force in the spine. I just want to get those hammies and glutes going. So I like this drill for low back rehabs for a couple of reasons. Again, his particular case, a lot of his symptom and a lot of his injury was driven towards having poor hip mobility, specifically extension, where he over leveraged a lot of extension at his spine and subsequently over time sequestered the disc. So this was part of his pre-op plan. It is part of his post-op plan because we're treating movement here, is he's working on opening up some hip extension on this downside hip. By lifting the front side, he's disassociating not only his hip from his spine, but his left hip from his right hip. And so I love this drill because it's kind of checking off 3 boxes for us at once in a very easy drill to teach and for him to execute at a high level. So previously we had been elevating Nick's hips off the ground using some yoga blocks. Today we're going to progress it, and elevating his hips off the ground, all that does is demands a little bit less hip rotation, so it's a regression for the movement. So we're going to have him kickstand over. We're really working on this trail side hip, so his internal rotation. Right, so what I want you to do, Nick, is try to rotate towards me a little bit and get that sit bone to drop to the ground. Beautiful. You feel that big stretch now? Yeah. Awesome. Let's just breathe right there. Comfortable? Cool. Just breathe there for 30 seconds, and we're going to start pressing this ankle into the ground. Our pales contraction, for those of you who follow the FRC stuff, we're going to do, this is an end range isometric drill. So we're creating hip mobility through a strength or resistant profile, right? So pressing down to the ground, right? As if he's trying to rotate his leg through the ground. And essentially what we're doing is creating more hip internal rotation, and we're loading it in that position. So we do a 30-second contraction, ramping it up, nice deep breaths, nice and comfortable, right? As soon as you hit that max effort, I want you to hold it for 10 seconds and then ease off it. Once you ease off it, I want you to kickstand over the front leg, and we're gonna go into just some IR lift-offs here. Lift it off, hold, and then slowly rock it down. Beautiful. Again, like, Mike, why are you doing all this hip stuff for his low back rehab? Again, he's still healing here. So we're taking these opportunities to leverage non-painful joints that have a meaningful impairment. So if he can clean up his hip mobility, he has more movement options that don't involve his spine having to change its position. Not to say that's a bad thing. The next drill, we're going to work on spine mobility. All right, so the first week, we introduced pelvic tilts / lumbar peel-offs or lumbar segmentation. Last week, we progressed him. So in week 1 post-op, we progressed him to a bridge. So today, let's just go through 6 to 8 reps of the peel-off, 6 to 8 bridges, and then let's see if we can reintroduce that anti-rotation part.
Segmenting bridge from
right, exactly. So the peel-off, right? So I'm going to slide my fingers underneath. So I'm just sliding my fingers underneath this side so he can feel my fingers underneath. So I want you to smash my fingers, right? And then I tell him, hey, I want you to move this segment, this segment, this segment, this segment. So I'm just giving him a kinesthetic cue. Call us a peel-off, because imagine there's a piece of tape on the ground, and I peel that tape off from one side to the other, right? So it's only one segment at a time peeling off the ground and then putting them back down in the reverse order. So we're using the ground as stability, but we're teaching him some active spine flexion. Do less. See, you're bracing so hard. Just roll that pelvis back, use as much as you need to, and slow it down a little bit. Up, 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 peel, 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 peel. And then back down nice and slow. That looks great. How's that feel?
Much better once I stop.
Right. Dude, you're not picking up 400 pounds. You're picking your pelvis up off the ground. That's it. That's awesome. Good. Now I want you to peel off, roll back, roll back, roll back, roll back, and now drive all the way through the hips, squeeze the butt cheeks. Right? You should get a little bit of a stretch here on the TFL. Now put one segment of that down at a time. Now, a lot of you might be thinking, that's a terrible technique to teach for a bridge. It's not really a bridge. We're working on segmentation. We're working on disassociation of his hips and his spine. So we're maxing out that flexion, driving into full hip extension, knowing he's going to lose some of that spine position, and then he's segmenting on the way back down. It's just a way for us to get a lot more ROI on the same time spent, but he's going to get good glute activation, good hammy activation. Come on back down. And we're also gapping those facet joints in his spine, which is therapeutic in the sense that it feels good. Press, press, press. Nice, dude. And then down one at a time. Here, here, here. Nice and slow. Let's go 3 more. When you bridge up, I want you to hold that position. And from there, what you're going to do, right, you're going to bridge up, hold that position. I want you to straighten one knee, straighten the other, and then come back down and segment the way back down. So the key to this is as you're bridged up and you extend, let's say, your right knee, you're going to have to push hard into this right elbow. The goal is to keep your pelvis level to the ground. Don't let this drop, okay? Squeeze, 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 hover. Oh, that looks good. And put it down, put it down. Now do this one. Hover, just for a second or two, and then down. And then segment down. How'd that feel? How'd that feel?
Good.
No pain? Okay, so you can straighten the knee out, that's fine. Or you can just pick the foot up off the ground. Just pick the foot up, yep, just like that. Just hover it, 2 seconds, put it back down. Peel up, squeeze, drive hard into the opposite elbow, good. So we're doing this little bit of a march. Here's what we're doing now. This is adding a stability component because now we're exposing him to a single leg stance, right? So now he has to resist that rotation at his rib cage and pelvis. So it's an anti-rotation drill. Again, you can train in rotation, but he's 2 weeks out of post-op back surgery, so I'm not going to do things that potentially could irritate that spine. So anti-rotation is a great way to train this without actually rotating his spine. So it's a great way to train those obliques, your core stability, your hips, kind of tying all this stuff together. Come on, drive those lats, come on. You got it. You hear him breathing? That's what rehab exercises should be like. If it's so easy that it's not challenging you at all, then you're not getting better. So again, rehab and strength and conditioning are the same thing, just a different starting point. He's bringing some intensity to this, which is why I said that I want you to bring intensity, but again, he shouldn't be bearing down and bracing as if he's picking up 400 pounds because he's only picking up his body weight. So we want to also have a breath strategy that's appropriate to that, okay? Let's go, let's do some cable pull-throughs, and then I want to go to the hip thrust. I think you're ready. All right, let's do it. So we're going to do a level 2 hip car. A level 2 hip car basically just means we're going to block off a compensation. So I kind of like getting up close and personal to an upright on the rack here, right? So my pelvis, my rib cage, my face, I'm squeezing this nice and tight, and we're just going to work on maintaining that contact the whole time. I really don't care so much about, here's what we can do though. If you're finding it's really difficult, we could do axial rotations. So I can go and find that sticky point and just work on rotating back and forth at that sticky point.
It's
right.
Here.
I can come here.
With Brian, I'm good here. It's putting it down. I hyperextend it.
You go to the back. Okay, so just work on here, 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 here. Do 2 or 3 reps and then extend. And just make sure you're pressing the pelvis or the boys right up on that rack. So bend that knee, stay right there. Externally rotate, out, internally rotate. That's it. And then you can just drop it right from there, right? You can just work on just that sticking point.
I think I have more range than I do.
Yeah,
You know?
so that's why we're doing it. That's why we're here.
Forcing it.
That's okay.
Just work with what you
Right,
have.
work with what you have. Remember, again, the goal here is just disassociation. We're really just focused on, can we work the hip independently of the spine? That's it. Side, better.
Right. That's side. It's just my right side.
Okay.
What I think too is like, I don't know if this makes sense, but like that side's been dealing with so much nerve pain. Remember all the stuff we're talking about? It's like we're sending signals and trying to get it like back on board so everyone's on the same page.
Here's the other part of that too. It's like peripheral nerves do regenerate. They take time, right? So sometimes when you have cases where the nerve root's being impinged by an actual anatomical or structural damage thing like the disc, the myelin sheath, the nerve coating, gets irritated or damaged. And that does recover now that that irritant's been taken away, but it might take a little while for the nerve to get back to being able to do its full job, okay? So it's not that it's damaged and it's never gonna come back. You might just have to be a little patient with it, that's all, right? So again, reasonable expectations for nerve regeneration, 1 millimeter of healing for like per month. So it's just a slow process. So one of the things that we were talking about is classically Nick likes to over leverage his spine extension. So when he pulls and plays when he does like an RDL, he feels a lot of hamstring but not a whole lot of glute. So what we're working on now is getting his rib cage down and cleaning up his hinge so he still feels that hamstring stretch, but we're just kind of loading this in almost like a hinge pattern. So the reason I like, again, he's only 2.5 weeks post-op. So we're using this cable pull through is because it's not putting a ton of axial loading, or he's not subject to that force of gravity going straight down. The resistance profile is this way. So yes, we're resisting hip extension, but we're avoiding any shear force or anything that might be irritating to his low back. So it's just a way for us to train posterior chain and get him back to a deadlift type motion without pissing off his back. How's that feel? Great, good. Let's go to 10 on these. Drive through, big chest, squeeze the butt. Love it. Nice, slow, slow, slow. Let's get that pause, drive. Good, I wanna still train as if we were doing a deadlift, right? Control the eccentric, Pause at the bottom, drive. Let's get that maximal stretch there. That's beautiful. Drive, rib cage down. Love that. That's awesome. Again, you guys don't get to appreciate how far this has come, but when Nick used to finish, it would look like this. Butt sticking out, back arch like crazy, huge pump in his spinal erectors. So the fact that he is a straight line from his shoulders down to his feet, and he's getting his hips all the way through, bueno, bueno. Drive. Good. Finish up with some hip thrusts today. I may add some external weight, but I'm thinking what I want to do is, because that looks really good, let's just go single leg hip thrusts. Okay. So again, I'm looking for the same hip hinge here. Just set up on the pad here. You can set up at the bottom. I like to kind of set up at the top, kind of feel that spot, right?
I'm not good with the fifth.
Right? Hinge, drive. Hinge, drive. Let's do one set on each side. A little bit. If that feels good, let's do 6 to 8 reps on each side. I'll give you the sandbag to hold here, okay? That's some external weight. Yep, I like to hook, yep, I like to do the same thing. So again, remember that peel off now. Remember that peel off. So tuck that tailbone. Good, now you're stacked here. We're gonna maintain that. Hinge into the hips, and then drive. Good, that's fine. Good, keep that rib cage down, right? Rib cage down, good. Beautiful. Beautiful. Take a break. Good. We'll do 2 more sets.
This side's strong, not mobile. This side's mobile, not strong. This leg's harder on the hip thrust. This leg's easier on the hip thrust. And I can't even move this.
Well, again, remember.
I know, it's just like...
We're not symmetrical. Plus, you're right-handed, right? So you're going to have better control with this right leg, but more strength on the left.
Right.
Right? Because it's like, like lobsters, you get the little pinchy claw, and they got the club claw. The pinchy claw can move quick. The club claw is super small, super slow, but it can crush you. So think about it this way. Your non-dominant side, more gross motor control. So if you're going to go dunk a basketball, you're going to jump off this leg.
That leg. That's what I was thinking.
Right.
So it's crazy how when
if you're going to kick a ball,
it shows you strength and mobility. And
right. You're saying mobility, dexterity, control.
Right. Control.
If you're going to kick a ball, you're going to kick it with this
for
control. So that's normal. That might not even have anything to do with the actual back issue.
Interesting.
Right. It could though. It's hard to say. Because you did have the right.
Well, I notice everything,
Right. But now you're your own student. You're your own student now, right? But here's that next set though. It's probably going to be even easier because we're going to get some post-activation potentiation here, okay? So this is what low back, post-op low back rehab should look like. Right. Beautiful. Right, remember, tuck that tailbone. Be aware of that core, right? Be aware of that anterior abdominal wall. Drive. Good. Nice. Drive. I like the breath. Good. 2 more. 5. 1 more. 6. Nice, dude. And relax. We're going to do 1 more set. Listen, the only reason we're not picking up a bar, I think you probably could and be totally fine. The only reason we're not is I just want to continue to let that back heal, but we're going to keep pushing these, well, again, my whole thing is if we put weight on the top of you, whether it's a squat, like a barbell back squat, or, and then let's just say you have a rep where it's like not the best, now you're adding that extra compressive force, which might irritate you. It's not a bad thing, but in this situation, we're eliminating that risk, right? Because again, the resistance profile is this way, but his body's moving, you know what I mean? It's more of a horizontal. It's similar to that pull through.
This is why you show up an hour in and I just mentally and physically feel 10 times better.
Dude, you're killing it.
Obviously what every session's supposed to be.
Right.
But it's easy to trick yourself into thinking it's not going to be that just because you feel a type of way.
Let me ask you this. How much is it because each week we've actually progressed your program and you feel the progression? Because I think my frustration at rehab as when I was an athlete for my knee was that I went to rehab for like weeks and weeks and weeks and weeks, and had the same thing every week. They never progressed.
And I think the issue with that is, I mean, especially with return to play, you got to go get your strength test in front of your surgeon. So if you don't have someone walking you through it and really pushing it, and correctively and pain progressively, of course. But what you do is you don't push yourself hard enough, and you probably aren't going to recover the way you should.
Right.
And then it just goes the way it goes.
All right, last one, maybe. Let's finish it. Okay, let that hip go a little bit. Come on, stay tight with it. It's all right. Feel good? Finish that last one. Much better. Good, switch him. I like it. He's not going to end on a bad rep. I love that. Good. Come on, last two, finish strong. Stick a fork in him. He's done. Good job, man. Really good job. I'm super proud of you. See you Thursday.
Yep.
Keep doing your thing on your own. Kind of crappy outside now, but let's get some cardio in later today. And then text me if anything changes over the next couple of days, but you should be fine. All right?
I think boat's a bad idea. I think it is right now.
To go on your boat? Depends on what kind of boating you're going to do. If you're just going to be on the bay fluke fishing, go.
Yeah.
I wouldn't go wave hopping on the ocean with
I'm
it.
more worried just about like that, just like.
No, you'll be fine. You'll be fine. Go enjoy yourself.
Okay.
You're not at risk right now. You know what I mean? The only thing that's going to be risky is if we're being stupid and doing stuff where we don't control the situation. You know, if you're going on a party boat, you could sit down while the boat's going in and out of the inlet.
Right.
You don't have to be like on the bow like Titanic surfing the front. Okay, just be smart. But if you're going on your boat,
No, it's it. Yeah.
the party boat.
Yeah. No. Friend's boat.
Oh yeah, dude. If you're fishing in the bay, you're fine. If he's
all
going
it
to be
is.
jumping the weights in the
Nah, you
ocean,
go
then
around
you're
Reynolds Sound.
you're fine. Go have fun. Enjoy yourself.
All right.
It's summer. You got to get a little bit of summer.
I did.
All right, man. That's it. Inside the look, session sit-in, a little bit of low back rehab. Again, the moral of this story is your rehab should not look that much different than your training. It's just modified with intelligent load management, just understanding the biomechanics, what we're trying to accomplish from a corrective standpoint, and just getting him back to where he wants to be. You know, you saw a little bit of manual therapy, a little bit of movement. That's what a good PT session should look like. Getting your needs met, feeling better, addressing pain promptly. But we gotta get in the gym. We gotta move some resistance, push the needle forward on your strength. So, till next time, session sit-in, keep being unbreakable. We'll get to you next time.